Hello, and thank you for coming. So if I can do a thought experiment here, imagine you're taking a shower, you feel a lump under your arm. It's never been there before. It feels hard, not like anything you felt before. And then you realize suddenly you haven't been feeling well. Something's happening. You make an appointment to see the doctor. You have an exam. You have blood tests. You get a CAT scan. The next day, you're sitting in the doctor's office, and the doctor's talking to you. The words are kind of going past. They're not words that you've ever heard before. And gradually, you realize you have cancer. What would you feel first? Terrified? Or angry? Or just blown away? You drive home kind of in a daze. You open the front door. Your partner looks up, says, "What did the doctor say?" At that moment, how much would you remember? That's the situation that happens over and over in doctors' offices and in people's homes. The problem, there's a gap between what doctors say and what patients hear. My name is Dr. Tony Buck, and I help doctors and patients listen to each other. I want patients who have a serious illness like cancer to get the information, the understanding, and the compassion that they need. My work is about bridging this gap between what doctors say and what patients hear. You know, when I was a younger doctor, fresh out of medical school, I thought my job was just about giving patients information. You know, you need this test, you need to see this consultant, you need this treatment. I gave out a lot of big information pills that I wanted people to swallow. I was kind of a one-way communicator. But a man I will call Bill was the beginning of my education, that actually wasn't enough, that knowing the technology was not enough to do the kind of medicine I wanted to do. Bill was a surgeon, actually, another doctor. He was in his 50s, a big, strapping guy. He had a cancer of the lymph nodes. His initial chemotherapy had failed, so he was here to get a stem cell transplant. You know, promising but risky. When I met Bill for the first time, he was already in the middle of his transplant. And, you know, because he was a doctor, he kind of knew how serious things were. You know, he knew that he might never get back to the work that he loved, being a surgeon. His wife took me aside and told me that Bill was really depressed, but, you know, being a surgeon, didn't want to admit it. Bill got a bad pneumonia with a bug that was untreatable, a kind of pneumonia that's basically fatal. I remember sitting with him, trying to explain the pneumonia to him. I tried to explain that we needed to move him to the intensive care unit and maybe put in a breathing tube. At one point in the conversation, he looked right at me as if to say, "What is really going on here?" It was a little moment of truth. The problem was, the only thing I knew how to do was give people information. I didn't know how to say, you know, what are you worried about? I mean, no one had ever told me you could say, do you want to talk about your prognosis? And of course, then I never thought to follow up with, you know, given this situation, what's really important to you? I didn't have any of those things. In fact, I'm embarrassed to say now, I was completely tongue-tied. I just froze. And I think he kind of realized that. I think he didn't want to embarrass me, so he just nodded. He let us move him to the intensive care unit. He let us put the breathing tube in and put him on the breathing machine. A few days later, right before he died, I was back at his bedside. His wife and daughter were holding a vigil. I spent at least 2 whole minutes just watching the breathing machine push air in and out of his lungs. It didn't look comfortable. I was trying to think about what the right thing to do in that situation could have been. And I remembered back to that moment of truth when he looked right at me. And even though he couldn't open his eyes, in fact, he couldn't speak because of the breathing tube, and he was completely sedated because of the breathing machine, what I remembered was the look in his eyes when he looked at me as if to say, what's really happening to me? And I could remember in retrospect that what his eyes were telling me was, I'm scared. But at the time, I didn't hear that. I didn't see that. I was talking. I was not listening to him. And, you know, I realized with his wife and daughter there that he was going to die, and he couldn't say goodbye to anyone. And I felt terrible about it. You know, this is the kind of moment, this huge gap between what I was saying and what Bill was hearing. This is the kind of moment that I've been working to try and change. You know, a lot of doctors would say, you know, you can't change this, it's unfixable. And you could lay blame in a lot of places. You know, you could say the doctors, you know, get uncomfortable when the emotions get really high. And, you know, of course, I don't like telling people something that's going to make them feel terrible, right? You could say the system doesn't reward doctors for, you know, having more skill at these conversations. You could say the research doesn't prioritize this kind of work. You know, there's a lot more money spent on trying to find a cure than trying to help patients adapt. But here's what I see. You can't change the fact that we're mortal, but you can change the way that doctors and patients talk about what's really important. Because a better conversation can change everything. If I had been more skilled in that moment, Bill might have made a different decision. And most patients, the research shows very clearly, don't want to die like Bill in the ICU. They want to die at home. They want to have their partner, their dog, their goldfish, their pillow. Later, when their families talk about what happened, their families say that they were more prepared, that they were less traumatized, and they have fewer regrets. So there are a whole bunch of reasons that make it clear why we need to have these conversations, because the kind of medical care that people don't really want is actually costing all of us this huge amount of money. And it's not even, you know, the money that actually gets me out of bed in the morning. It's the issue that we're not doing the right thing for people. You know, the better conversations are really within our grasp. You know, I've been working for 15 years in ways of learning for doctors that enable them to use their heads and their hearts, because they need their medical expertise and humanness. You know, first we teach doctors some listening and asking things, you know, like tell me more, what are you worried about? Then second, we give them maps through difficult conversations, like the one I could have had with Bill. And then third, we teach them to be more present. And that being more present, the ability to really focus and hang in there in the midst of a really intense situation, that is a skill you acquire. It's not something you're born with. You know, what do doctors say after, you know, having this kind of training? They say, well, gee, I didn't know these conversations could go differently. They're so used to muddling through and feeling terrible later that they just want to forget about the whole thing. But we can take those doctors and move them up a whole level of skill, and we're scaling this training up so that we can reach thousands of doctors who've never been exposed to this before. And that's a game changer in American medicine. Contrast that, my story with Bill, to a second story I'll tell you about a guy named, I'll call Tom. Tom was in the insurance business. He had 2 young children, totally adorable. He used to show me pictures of them on his iPhone every visit. And he came to see me because he had cancer of the stomach. At first he did pretty well. He had his surgery, he had his chemo, and things looked good. He came to a visit, drove here from the peninsula just to ask me, is it okay if I have another kid? Because he wanted to be a responsible father. He did not want to do something if he was still at risk. And I said, go for it. And then when his daughter was born, we celebrated. But a couple of years later, he ended up in the hospital because he couldn't breathe. And the tests showed that the cancer had spread all through his lungs in a shocking, horrible way. And I was dreading going in to talk to him. But this time, I was better. This time I knew I could prepare myself by taking a moment before I went into that room just to make sure I was ready to be completely present for him, not to be distracted with all the things I shoulda, coulda, woulda done. When I talked to him about his medical situation, the fact that it was really beyond any treatment that we had, he started to get teary. And yet I could see the tears, see how scared he was, and not try to distract him by saying, it'll be okay, because it wasn't. I was just present. And he looked up for a minute and said, I'm a good Christian man. I have a lot of faith. And so I could get a glimpse within that fear of something that might be a source of strength to him. So I said, I went out on a limb a little bit. I said, would you like to pray? And he said, yes. So I went out a little bit further on a limb because I don't have the same faith, but my faith wasn't the point. It was about a possible source of strength we might be able to tap into right then. And I said, would you like to lead us? Well, it turned out he knew exactly what to do. He called his family around the bed, we made a circle, and he led a prayer in a voice that I had never heard from him before. In my clinic, he was always so nervous and anxious, and yet in this moment, when he was facing, one of the most horrible things for a father, he was strong, he was authoritative. It was a transformation. And he asked his God for strength and mercy. He gave his family blessing, and he kind of gave me a blessing. And it's a blessing I still savor to this day. Because the gap between us, one where he could hear what I was saying, draw on his own strength, and change this moment into something that his family will never forget. That kind of moment is the kind of moment that's a turning point in the life of a person with a serious illness. This kind of moment is why we need doctors who can bring together their humanness and their medical expertise to do something different in the face of what's now a very complicated environment. We need a medicine now that puts our humanity front and center so that we can use our technology in the service of our hopes, our loves, our fears, everything complicated that makes us human, and puts, people like Tom and me really in the same place, side by side, facing issues. So if you're a doctor, here's my takeaway. These kinds of communication skills are things you learn. They're not things you were born with. If you're a patient, my takeaway is find out how you can draw on your sources of strength and rise to the occasion. Right? And if you're a person who just knows somebody with a serious illness, try this. Try a small act of courage. Try closing the gap between you and that person, and just be present. Try waiting and feeling into the moment to see what emerges, and stop giving advice, passing on emails, and worrying that you have to fix something, and just see what happens in the moment, because what happens in the moment might just transform you both. And that's my idea worth spreading. Thank you.